There's one emotion or mental state that seems to block doctors or therapists from becoming the world-class non-surgical chronic pain specialist they want to become more than anything else. And it is the emotion of shame. I wanted to talk about it today, primarily because it's an emotional state that I've dealt with my entire life. But I am also in an 8 or 9 day streak right now of feeling very deep shame that is just making me reflect on what some of our doctors and therapists go through, what I've gone through in the past, and how I deal with it and process it, so ultimately I can come back to doing the things that I want to do, which is ultimately being the best doctor I can be and serving people who are suffering in pain and really need us. What is shame? Why do we have it? There are some people in the psychotherapeutic fields who talk about shame just being toxic shame. There's a book by John Bradshaw that's called Healing the Toxic Shame That Binds You. It was a really good book. I don't believe that all shame is bad. Shame is something that we typically will feel. I feel ashamed when I do something that puts me in a state where I feel less than human. It's a little bit different than guilt, because guilt is I did something wrong or bad, but I don't view guilt as really changing someone's state so significantly that their nervous system is really wanting them to change like shame does. So guilt is like, okay, I did something wrong or I did something bad, so we feel that energy. Feeling ashamed is I'm feeling less than human right now because I treated somebody, something, someone very poorly, and it's an opportunity to shift our behavior so that the outside world, our society, people are protected from us. So it's a sentry that's facing in from the outside world to protect the outside world from us. Anger, on the other hand, is a sentry protecting us from the outside world. So I look at anger and shame as these two sentries who are just protecting people. So that's what shame does. Toxic shame is typically a pattern that we have from childhood where we have low self-worth all the time, even if reality doesn't dictate that we should have low self-worth. If a child is 8 years old and they're just being a child and they play all day and they laugh sometimes and they try to smile and have fun, but because of their environment that they're growing up in, they just feel ashamed or like they're worthless and they don't deserve to be alive, that is toxic shame because it's not based in reality. It's not true. So regardless of where your shame is coming from, I think it's important to put your finger on it so you can identify it and understand what you're working with. I think the first thing is to realize intellectually that you are a whole human being. You will never be less than, you will never be more than. Ashamed is a feeling that's trying to calibrate you towards the middle if it's true shame. I just got back from an RLT seminar created by Terry Real. He's a psychotherapist, relational life therapy, I believe it's called. And they have this grid where you have boundarylessness and walled off on the x-axis, and they have one up or grandiose and one down or shame on the y-axis. And when you're in conflict with another person or your partner, you figure out what your patterns are and how you function so that you can be aware of how your adapted child, when you were traumatized, scared, whatever as a kid, what you go to do so that you can work with and hold your adaptive child. But the whole idea with this y-axis thing is that if we're grandiose, we need to bring ourselves down to whole and equally human. If we're ashamed and we're one down, we need to bring ourselves up to whole and equally human. And if we're seeing everybody else as whole and equally human, we have the right lens on. But if we don't see other people as whole and equally human, something is off. And so this is more of an intellectual understanding that we need to own that all human beings are equals. And to the extent that we don't see other human beings as equals, that is an inherent problem that we need to intellectually grasp. If you struggle with this, what I would do is I'd probably put this into ChatGPT and say, this crazy guy named Dr. Chris says that all humans are supposed to be equal and that shame brings us less than, grandiosity is higher than. Help me process this and work with it. That's what I would do. As I was walking this morning and I'm feeling like a piece of shit and I'm having really dark thoughts, I have to remind myself to focus on the emotions and the pain underneath the shame, because toxic shame isn't truly helpful. It's just allow my mind to simmer and to ruminate and Chris, fuck you, you could kill yourself. Like, that's not helpful. It's not helpful for me. It's not helpful for my patients. It's not helpful for my family, my sons, my partner, Katie. So I focus on the pain. I focus on the pain, especially from when I was younger. I focus on the pain of not necessarily having my parents being emotionally available the way that I wish that they did. I will focus on the pain of not having somebody be able to correct my mindset from an early age. I was talking to my buddy, Dr. Sean Pastuch, on Instagram, and he was talking about one of his kids, if something happened with a teacher at school. He was like, it's fine to expose your children to stressors at school. And I was like, how could you say that? Well, what if it completely poisons their mind? And he's like, that would never happen because I'm their dad and I would catch it that day. And I was like, oh, that's the key, is that I had these poison seeds planted inside of my psyche, and I didn't have anybody to come in and just excavate them and say, Chris, you're actually whole, okay, and loved. Like, you're actually okay. I was like, huh. So I focus on the pain of that, the sadness of not having that. Focusing on these emotions allows me to actually metabolize true and real emotions that are actually helpful. Because focusing on toxic shame and dark thoughts and rumination, it's not going anywhere productive. Third is I invite all of my dark shadow parts that I don't like to tea. This is a Ram Dass thing. And the idea of inviting your dark thoughts to tea is that you're loving all the dark parts of you, because all human beings have light and dark sides. And if we're fragmenting or separating the dark sides from our psyche, we are separating ourselves, and we're separating ourselves from spirit or God at the same time. And so the idea of inviting your parts to tea is you can do this just when you're walking around or standing, but I really like to do this in meditation, is I quiet my mind, I breathe into my heart, I calm my nervous system down, and I imagine inviting different shadow aspects to myself. And sometimes I'll even visualize what my shame or my anger or my rage will look like, and we're all drinking tea, and I'm practicing loving them. Or I might even do an internal family systems exercise where I'm asking them questions. This works really well with MDMA or other psychedelics. So if I'm under the influence of these medicines and it shuts the amygdala off, I can directly dialogue with these pieces of myself, and it allows me to work with and integrate those fragments of my psyche with who I am and practice loving myself. Because typically when people are ashamed, there's a lot of self-hatred. At least for me, I can say that there is. And so the practice of loving myself, I have to counteract the 10 years of destruction I did to my mind and my body with being a wise adult and continuing to cultivate good subconscious neural patterning, so that when I'm 50, 60, 70, 80, 90 years old, I view the world with love and joy and happiness, and not just darkness and fire and brimstone. The fourth thing that I do is that I pray. And if you're atheist, I hope that you will work on developing a relationship with whatever you want to call spirit or God. I know when I was struggling as an atheist, what really helped me was, as a scientist and somebody who studied biology, can I believe in the quantum field? Because the quantum field is the idea that reality is actually conscious. And so truth realization is the idea that truth or consciousness is the fundamental building block of all reality. I will often just substitute God or spirit for the quantum field because I actually believe that's the way reality is, and it's worked for me and it resonates with me. And so whatever your intentions are from seeing in the world, generally speaking, slowly and gently over time, and we're learning more about reality, is we manifest what we want to observe or what we want to see. And so the idea of praying is the idea of connecting with this energy, asking for what we want and expressing gratitude for what we have, which allows us to attract more as a quantum magnet, and to dialogue, because often in life we are not in control of things. Surrendering is the idea of saying, okay, quantum field, spirit, God, earth, whatever we want to call it, you're in charge, guide me with what I'm supposed to do. Because there's a lot of stuff that happens in this world and in life that we're not in control of. What's the explanation for that? There's an intelligence at work, and praying allows us to connect with that power and that influence. And it just allows me to feel a lot of peace at 40 years old that I couldn't imagine I would have ever felt when I was 35 or 30 and I wasn't praying as much as I am now. The fifth thing that I've done and that I'm doing now is inner child meditations. So like I said, I was just at this RLT seminar with my partner Katie in Georgia, and they talk about the wounded child, which is the child between 3 to 6 years old who's just very traumatized and scared. The adaptive child, who's usually somewhere between 8 to 12 years old, who gives you protective mechanisms allowing you to survive, and the wise adult who can bring your consciousness and allow you to move forward in a productive way that's conducive towards the goals and things that you want. A lot of the people in the seminar, when they were reading their letters to their adaptive child, they were all crying and bawling. I did the exercise, and it's always a very helpful and productive exercise, but I didn't have any emotional charge to it. That's because about 10 years ago, when my Imago therapist was having me do inner child meditations with 6-year-old Chris, and the first 5 times I did this meditation, and little Chris in the theater of my mind would not budge from playing his Legos or even look at me, or give the current level of Chris, who was 30 years old at the time, wouldn't give him any attention. I told my therapist Stephanie at the time, little Chris is fucked. He won't even look at me. He won't even acknowledge my presence. And what I did in those inner child meditations is I developed, at the time I was really obsessed with elephants, and I kind of still am. Ashes and Snow is this really cool elephant photos and portraits that some artist did. I sent in a baby elephant named Ellie in to connect with little Chris. And at first Chris wasn't paying attention, but very soon he got curious and would look up with his eyes and look at the baby elephant. The Ellie would go and try to nuzzle next to him. Eventually Chris would look up and start petting her. Eventually he'd start smiling at her. Eventually, after doing these meditations a while, Ellie and Chris were frolicking in the ocean, and Chris was very happy. And then the real life state of what I felt like after little Chris felt happier and felt like he could play because he had worked on this nervous system pattern in his brain was that I just felt safer as an adult. So working with your inner child is a really great way to work through negative emotions, darkness, but also shame. The sixth thing that I do is self-care. I do about 2 hours of work in the morning. I typically would do 30-60 minutes of meditation. I'll usually go for an hour walk. I'll usually do 10 to 15 minutes of the prehab exercises we give to all of our patients that prepare for rehab. I'll usually go in the cold tub. I usually do some qigong exercises that I learned from Mike Chang on Instagram. And then I'll typically do some journaling or gratitude. And if I don't do those things, I just don't feel good about myself. Whether that I've conditioned myself to need this or whether that's just who I am, I don't know. But self-care is self-love. So if you're struggling with self-love, a good way to get yourself to feel self-love is by doing self-care. The seventh thing that I do is goal setting. I want to do some bad stuff to myself. I used to burn myself with coat hangers and heal in the stovetub. I used to get my friends in college to hit me with bamboo sticks. I used to write hate you letters to myself. I used to punch holes in walls. One of the simplest goals that I have is to raise sons who are emotionally healthy and happy and have the best chance of living a powerful life. That's my goal. I can't allow myself to simmer in shit, whether I won't be present for them now or whether their subconscious mind is just being around somebody who's ashamed all the time. We tend to not think that kids are absorbing this stuff, but they are. So my goal is to be present for my sons. Another one of my goal is to be present for all of the patients that I serve every day who are in chronic pain. I like to think that I'm probably one of the better chronic pain specialists in New Jersey, and I'm not sure where they would go until either our apprentices are more trained or somebody else who's more trained than I am, since it's been almost 20 years, can come in and serve these people. So I'm focusing on that goal, and I'm not allowing myself to stay in that shitstorm in my head for longer than necessary while I continue to just let this process of shame activation settle and quiet and die down. I've talked about this a lot. I commune with psychedelics. On one level, I can be seen as an addict. I like to use substances. I like to explore consciousness. I like what it's shown me about some of my patterns. but I don't know if I would still be alive at 40. Even though I've only been doing psychedelics since about 30, it's been very rough the last 10 years, and I view psychedelics as an enormous outlet for people who know how to use it in the right way, with somebody who is a proper facilitator or healer and knows how to hold you and make sure that you're safe, and to work through some of your old patterns. Whether that's just conditioned nervous system patterning, or whether you actually have trauma that's stored in your body that's repressed that you need to shake it out. It's been enormously valuable to my life, and I don't plan on ever stopping using or communing with these medicines until the rest of my life, because they continue to help me dissipate stress. They continue to help me show me patterns that I'm using maybe even currently in my everyday life or the way that the world is. It connects me with spirit or God, and I can't say enough about the use of psychedelics and finding somebody who can help you properly and keep you safe. I don't take it lightly. This stuff is to be respected, but it's enormously valuable. And the last thing that I do as a pain doctor or therapist is I train. Primarily with my mentors, Precision Health Group in St. Louis, and I've trained over the years. I know in 2016 and 17, when I was very ashamed of myself for not training for 3 or 4 years, I think I trained 25 times in 1 or 2 of those years. I spent over $100,000 with Dr. Brady of Integrative Diagnosis, because when I am physically feeling like I'm getting patients better, I'm doing everything I can to get them better, I feel better about myself. So in the past week, I was just thinking to myself, training 6 times in St. Louis is not enough. So I think for next year, I want to talk to Katie and see if somehow with my family, we can find space so that I can train once every single month, so I can continue to develop my skill set, because the training never stops when you're treating adhesion and you want to be a non-surgical chronic pain specialist. So I just put my energy into making myself a better human being, realizing that I'll never be a better human being from someone else because we're all equal, but making myself feel better about myself is an act of self-care and self-love, and it allows the activation of shame that's activated in my brain to just continue to untangle and deactivate over time. So these are the things that I've done over the years and I'm doing over the past 7 to 9 days to work with my shame. 1, we're all whole, equal humans. 2, focus on the emotions or the pain under the shame. 3, invite all of your parts to tea. 4, pray. 5, inner child meditations. 6, self-care. 7, commune with psychedelics. 8, what are your goals? Focus on your goals. And 9, train in becoming a better doctor or therapist. If it's not adhesions, who's your mentor? Go study with them more. If you made it this far, I love you very much. You're not alone. You don't have to suffer alone. I hope this is helpful. You can comment if this is on YouTube, or if this is on our email list, you can respond back to me and I'll help you or support you in any way that I possibly can, because you're deserving of love. And if you're a doctor or therapist, we need you on Heal Team 6. We need you to do everything in your power to be the best possible doctor or therapist you can be, because people are suffering in chronic pain. I was in the airport yesterday for 6 hours and I was just responding to comments and Instagram DMs all day of people in pain. And I was like, damn, there are a lot of people who are looking for help. So we need you.